Welcome to Eye on Yellow Fever. If this is your first time listening, this is a podcast from the Global Coalition of Partners working together to end yellow fever epidemics by 2026. The Eye Partnership includes Gavi, the Vaccine Alliance, UNICEF, the World Health Organization, the Bill and Melinda Gates Foundation, the U.S. Centers for Disease Control and Prevention, and a host of other organizations around the world. The Eye Strategy's primary goal is to end deadly yellow fever epidemics by 2026. In Series 1, we talked about how, with coordination, effort, and resourcing, that goal is possible.
There's a lot of stakeholders involved in fighting yellow fever. We all need to take each of our tools within our toolbox in order to serve those communities that are the most vulnerable.
For me, the call to action would be to immunization managers and to the decision makers at country level to take really full advantage of this Eye strategy. This is a time-limited effort, that goes through 2026 to eliminate epidemics.
But it's also clear the challenges we face are increasing and can be frightening to think about. Global warming, deforestation, more people living in cramped and badly serviced housing in slums or migrant camps. These are all contributing factors to a greater risk of catastrophic yellow fever spread. How do we know this? Because it's already happened.
Here we have what is turning out to be the hugest yellow fever outbreak in recent years.
In early 2016, a yellow fever outbreak, an initial 23 cases in Angola's capital, Luanda, spread exponentially. It was transported to China and had spread widely both through Angola and into the Democratic Republic of the Congo, including its densely populated capital, Kinshasa.
So we were scared. We were a little stressed. We started to panic a bit.
This 2016 outbreak was a major factor in the decision to set up Eye and all the work we do in the partnership today. But what does preventing outbreaks look like on the ground? That's what this new season is all about.
The risk of outbreaks of the deadly disease yellow fever is both significant and growing. This is down to a cocktail of contributing factors, including climate change and increasing pressure on land, greater movement of people, particularly into cities, and a resurgence in our highly connected world of the mosquito species that carries and transmits the disease. Yellow fever may not be the most obvious global public health threat, but it's a disease with no cure and a growing risk that must be taken seriously. We are Eliminate Yellow Fever Epidemics, that's Eye for short. From the world's most senior public health experts to those on the front line of combating this deadly disease wherever it emerges, we have the inside story on yellow fever's expanding global risk. This is Eye on Yellow Fever.
Hello. I'm Maggie Silver from the U.S. Centers for Disease Control and Prevention, one of the partners of the Eye Strategy. This episode of Eye on Yellow Fever, the first of our second series, is about important work being done as part of the Eye Strategy to ensure governments are always prepared to respond quickly to prevent or minimize urban outbreaks of yellow fever. As happened in Angola and the Democratic Republic of the Congo in 2016, an urban outbreak can easily spread, can get out of control, and can be transported from population center to population center via land, sea, and air transportation hubs. An outbreak of this kind presents the clearest risk of rapid and catastrophic transmission.
Past experience showed us that it may happen, it has happened.
Dr. Peter Mbondji has worked in public health for over 20 years and has been part of emergency response teams dealing with yellow fever, COVID-19, cholera, and other outbreak diseases.
And it's very important that we learn from the past, from what has happened, to make sure that countries are ready to detect first and to respond early to any yellow fever outbreak in its urban area.
Dr. Mbondji's role in Eye is to develop guidelines for preparedness, readiness, and response planning for yellow fever outbreaks in urban settings. He is responsible for publishing comprehensive and practical guidance giving at-risk countries tools to support prevention and readiness to respond to urban yellow fever outbreaks.
If we have a large amount of people in an area, if ever there is a yellow fever case that arises in that area, we also have a risk to have a rapid spread among those people. The permanent flow of people among different cities can make it a national catastrophe very quickly. That's why we need to make countries understand that they need to work out a resilience system to yellow fever in urban areas. In Africa, we have got very large outbreaks. We got the Angola outbreak in 2016 that spread to DRC, and with some few cases exported up to Asia. So this really showed how fragile is the preparedness to yellow fever outbreak, especially in urban settings. So the idea behind what we are developing now is really to support countries to develop some strong preparedness, readiness and response plans to make sure that countries are ready to face any yellow fever outbreak.
We'll hear again from Dr. Mbondji shortly, with more on the specifics of the guidelines he is responsible for preparing. But first, I want to introduce our other guests for this episode, a senior public health official in the government of Cameroon.
I'm Dr. Linda Esso. I'm a medical doctor. In my country, I'm in charge of the control of epidemics and pandemics since 3 years now in the Ministry of Public Health. I'm in charge of the control of cholera, yellow fever, COVID-19, measles, etc.
There are a number of reasons Cameroon is at risk for a serious urban yellow fever outbreak: densely populated areas, often poor living conditions, and low population immunity. Dr. Esso also says that parts of the country face forced migration due to violence and insecurity.
Yes, most of our population, more than 56% of our population is urban, living in poverty, but with the insecurity in our country, but also in the neighborhood country, there's a lot of movement of population in countries which are known in epidemics of yellow fever. So the risk is great in our country if you have an urban outbreak, the risk of expansion at the local level, at the international level, and the difficulty that you have in raise resources to fight against these outbreaks can make it rapidly uncontrollable.
Dr. Esso, thank you so much for joining us today. My first question for you, can you help our global audience understand the broader public health context in Cameroon? I know yellow fever isn't the only public health issue that you have to contend with.
Now in Cameroon, we are dealing with many outbreaks. We have a cholera outbreak now, even a measles outbreak, a monkeypox outbreak, and a polio outbreak. In the northern part of the country, we are dealing with the Boko Haram. In the southwest and northwest region, there are some kind of violences between some members of the community. So people are obliged to leave their community to go elsewhere. So we have a lot of IDPs in some other regions that make them overcrowded.
IDPs, internally displaced people, who have had to move within their own country because of conflict or environmental disaster. Cameroon also has people arriving from neighboring countries that are dealing with insecurity, like the Central African Republic and Chad. It all adds up to an overburdened health system, particularly when it comes to outbreak response.
There's a lot of people coming and going inside and outside.
You certainly have your hands full. How does preparedness for urban yellow fever outbreaks compare as a priority alongside all these other outbreaks that you just listed? How is your team dealing with that and trying to prepare for yellow fever?
All those problems are priorities because we know the risk in terms of mortality, but also the risk in terms of expansion of the disease at the local level, even at the international level. So all those are priorities for our country. And what we have to do is to integrate the interventions that we put in place at the maximum to mutualize all the resources that we have.
Cameroon's government is not unusual in having to manage and juggle competing and often very grave public health concerns with limited resources. And more recently, of course, everything has to be seen through the lens of COVID-19. What do you do to persuade colleagues that it's important to put resources into being ready for an urban yellow fever outbreak, giving all the competing priorities? How are you getting them to prioritize yellow fever?
In the context of COVID-19, it's a big challenge to persuade our colleagues, our hierarchy, and even our partners to raise funds, to raise resources to fight against another outbreak than COVID-19. So it's a big challenge, but we conduct a lot of advocacy based on evidence. And we know in our urban area, the density of population is so high. So the risk of the transmission of disease also.
As a public health official in charge of outbreak response, Dr. Esso also has to be aware of the risk of diseases like yellow fever being incubated locally and then transported widely to other countries. In 2021, Cameroon welcomed visitors from across Africa and the world as it hosted the African Football Cup of Nations.
Considering the risk to have urban outbreak of yellow fever and the risk of expansion to the other countries during this period when there was a lot of population coming outside of Cameroon.
Particularly during the Cup of Nations, when crowds poured into Cameroon from around Africa, Dr. Esso says the fear of a major outbreak unlocked resources, including a donation from the ICG, the WHO's International Coordinating Group on Vaccine Provision. She also says the EYE's response guidance for urban yellow fever outbreaks, led by Dr. Mbondji, has been vital for making preparations and for managing relationships with government colleagues and partner organizations.
It was like a guidance document to elaborate the country document, considering vaccination, surveillance, but also anti-vectoral fight. So we took it in account to readjust our plan, but also to touch all the others that are involved in the fight against yellow fever. Those guidance was of big interest for us, and we shared it even at the highest level.
You are listening to Eye on Yellow Fever. We are back with this brand new series. If you haven't already, you can find all 10 episodes from Series 1 already in your podcast player. And if you're interested in other podcasts on global public health, check out Global Health Matters. Host Gary Aslanian is joined by renowned experts and emerging voices in global health, with a focus on perspectives from low and middle income countries. Season 2 features topics like access to medicines, science diplomacy, the future of public health programs, diversity in global health, and much more. Just search Global Health Matters in your podcast player for that one. Here, in this episode of Eye on Yellow Fever, we're still focused on the vital importance of preventing urban yellow fever outbreaks. We've met Dr. Linda Esso, a senior health official in the Cameroon government, and heard how the EYE strategy has been instrumental in shaping their own in-country yellow fever response. We'll hear more from Dr. Esso shortly. For now, we're back with Dr. Peter Mbondji for detail on EYE's recommendation to countries, like Cameroon, that are at risk for urban yellow fever outbreaks. The guidelines are intended to dovetail with the country's own wider plans for responding to hazards and diseases.
The main recommendations to countries is really to think of mitigating the risk of urban yellow fever. For that, we call for countries to develop a strong preparedness, readiness, and response plan. This is the first thing. It's also about promotion and education of good practice of health in the population. But I think the most important thing is really to organize and to make sure that we can increase the immunization rate of yellow fever. This will go through the organization of routine mass vaccination campaign and make sure that we put it in a national program that will really aim to cover all the population. And for the rest, we need to put a strong surveillance system in place for early detection and also a full mechanism for response.
So, 1. Have a comprehensive plan to monitor for and respond quickly to outbreaks. 2. educate people widely about the causes of yellow fever and how to stay healthy, including reducing mosquito bites, being vaccinated, and knowing the signs of illness to rapidly seek care. 3. Most importantly, get people immunized against the disease, encouraging routine immunization and also preventive mass vaccination campaigns to protect unvaccinated people living in high-risk areas. We say this a lot on the podcast, but yellow fever has a safe and effective single-shot vaccine that protects people for life and is a cost-effective public health intervention. And 4, be vigilant. We can work together to detect yellow fever outbreaks early with strong surveillance and be ready to respond quickly. Because if there's one important thing to understand about yellow fever, it's that prevention ahead of time is safer and usually far easier and cheaper than bringing in the teams of highly trained specialists required to shut down an outbreak.
Yellow fever, to respond to yellow fever, there is a need to have a multidisciplinary approach with different teams coming from different sectors. Only for vector control, you need to include entomologists, for instance, and only for health, you have the epidemiological surveillance and you have also the immunization programs that have to work together. If nothing is done, the early detection and the response to yellow fever, it might be a real catastrophe for urban areas.
So, what are the practical realities for governments of low and middle income countries at risk for yellow fever and other outbreak diseases? Countries like Cameroon. Dr. Esso, you're talking about how you work across all of these different diseases. So, are there certain ways that you're working to make your resources go farther? For instance, finding co-efficiencies, whether it's funding a laboratory, for example, that can help with yellow fever testing as well as measles or monkeypox. What are some of the co-efficiencies that your organization is trying to find so that you can fight all of these different fronts for public health?
Concerning the lab particularly, one of our challenges is to put in place the laboratory network, a national laboratory network, so that we build the capacity in all the regions and locality of the country to confirm the outbreaks. We have to put in place a national network, but also to put in place a strong system of reference and also a strong system to manage data is to reinforce our surveillance and response system.
Dr. Esso also references a challenge faced in ensuring an equal response. Systems to detect and control outbreaks need to be just as robust, even in areas that are further away from administrative centers. It's an important lesson that she says came to the forefront recently in her country's response to COVID-19.
Some regions are stronger than others. We have the central region where the institutions are. We can easily support this region, but other regions are weaker than this one. And these are the regions where we have most of the outbreaks and where we have most of the cases of yellow fever, notably Adamawa, notably the East region, for example. We did it with COVID-19 by the deconcentration of the response at the local level. So each level can put in place rapidly coordination for the control of outbreaks.
We'll finish this time with some thoughts on something both Dr. Mbondji and Dr. Esso agree is vital to tackling yellow fever. That is education. Education about the cause of yellow fever and what can be done in response to outbreaks, from reactive vaccination campaigns to mosquito control, to reduce the spread of disease. Education can also mean helping communities to understand the scientific causes of illnesses.
The first thing we have to convince the population to is that it's a preventable disease. So there's a lot of sensitization we have to do to convince them that our interventions are safe. Because in our societies, in our context, in our African society, there's a big challenges about those people which they think that everything is witchcraft. They have to go to traditional healers that have the cure. This is very frequent with yellow fever, particularly when they have yellow eyes, when it's jaundice. Most of the population knows that they have to go to the traditional healer. So we have a big challenge to convince them to come to the health facilities because there are many traditional healers that concocts some concoction to treat jaundice, even if there is not a clear diagnosis behind this jaundice.
One key intervention that Dr. Esso says is making a real positive difference is providing education to the traditional healers themselves, so that when people come to them for help as trusted people in their communities, they recognize yellow fever and know how to direct people to appropriate services.
They are becoming part of the solution in our interventions. They are even sometimes part of the key informants that we take in the communities to reinforce our community-based surveillance. So we train them. They even have tools to report the events that they found in the population, notably cases of yellow fever. So now they are part of our response strategy, but we have to capture them all. We have to do a cartography of those people which can help them to build a strong surveillance system to rapidly capture all the cases.
Such a fascinating chat with Dr. Linda Esso, Senior Health Official in the Government of Cameroon. Many thanks to her. Thanks also to Dr. Peter Mbondji from the I Secretariat. The key message to anyone in public health in countries at risk for yellow fever is to be prepared. Have a plan in place so as to be able to respond quickly in the event of an urban yellow fever outbreak. Every minute counts. And if at all possible, please consider planning routine yellow fever vaccinations to stop the outbreak before it even happens. Anyone who'd like help or guidance on this should speak with the I strategy team. As we kick off this new series of Eye on Yellow Fever, a reminder that word of mouth is so important when it comes to reaching new audiences with podcasts. If you have colleagues or friends who you think would find this episode or the series interesting or useful to their work, please let them know about us by sending them a link. You can also select subscribe or follow to make sure that all future episodes of Eye on Yellow Fever are automatically downloaded direct to your device. Also, we would love for you to leave us a review in your podcast player. What are we doing well? What would you like us to do more of in the future? This episode was produced by Dave Howard with research from Amelia Jansen and sound design by Adam Whaley. I'm Maggie Silver. Eye on Yellow Fever is a Bengo Media production for the Eliminate Yellow Fever Epidemic Strategy.